One particular concern for most people considering transplant as a treatment option is the financial costs. A marrow or cord blood transplant is expensive, but there are numerous resources available to help. So it's important to consider how a transplant could impact you financially while you are still weighing your treatment options. These considerations include employment. You'll need to take time off, up to a year or longer. Your caregiver might also need to take time off. Insurance coverage. Does my insurance cover transplant? Are there limits? Does my insurance cover prescription drugs? Disability insurance. Does my company offer disability insurance while I'm not working? Retirement plans. If you were close to retiring, is this still an option for you? More information about financial planning can be found in the booklet.
I covered the cost of the transplant with insurance. The long-term disability kicked in after short-term disability, and then, long story short, I needed to go back to work anyway, but, long-term disability gives you up at so much, so it was time to go back to work. I have two daughters, 16 and 20, one a sophomore in high school, and the other a junior in college. So, going back to work, had nothing. I was going to go back anyway, but because they both go to private schools, I have to go back to work.
Another financial consideration is to determine where you will have your transplant. Depending on where you live, you may need to travel to a transplant center, a hospital that performs transplants. Going to a transplant center that is further away means additional costs such as food and lodging for you and your caregiver.
I had to travel about 200 miles to the transplant center. When I was actually going to the transplant, I had to stay there at the center, but I would have relatives traveling back and forth. Even though it was very reasonable, you still add up the costs of lodging. Traveling back and forth is, gas is not cheap, so you don't ever think about that. Another thing that really hits you with finances is, even though I had prescription medicine, the copay, if you have one, can be really add up.
A lot of the expenses with the living, too. Away from home 7 months. No car. You have to go shopping, you call a cab. Fortunately, Eddie and I had a drug card. And even with the drug card, the first year we went through $5,000 out of pocket. We knew it was going to be costly. And we thought, well, there goes our retirement money. And we went through it. But it'll come back again. It was worth it. Because what good was having it without it?
It's very important to understand how you will pay for the transplant costs, including your insurance coverage, as you're thinking about transplant as a treatment option. If you want help figuring this out or finding financial resources, you can call the National Marrow Donor Program's Office of Patient Advocacy at 1-888-999-6743 and ask to speak to a patient services coordinator. After your transplant, you'll need to spend at least a month, and probably longer, in or near a transplant hospital recovering. After that, there is a long recovery process at home. This recovery can last up to a year and sometimes longer. Your team of healthcare professionals will watch you very closely for fevers, signs of graft versus host disease, and any other side effects.
The truth is that after transplant, there's really a new normal. Most patients have a new body and a new way of having to deal with things. And there are problems after transplant that they didn't have before, and they have to learn to cope with those. Maybe low energy, maybe chronic graft versus host, maybe some ongoing problems. These are really the price of trying to treat and cure their cancer.
There's going to be a lot of side effects. There always is side effects when you take medication. You have to deal with it day by day.
Well, when I first came home from the hospital, to be quite honest with you, I felt worse the first 3 weeks than I did when I was in the hospital. You do have to have patience. And you have to be realistic about what is reasonable for you to accomplish in the amount of time that you've got or that you've spent on trying to recover.
Having a transplant from somebody else, an allogeneic transplant, will make all patients feel tired. And it makes them feel tired for periods of time that can last up to a year after transplant. It matters a lot how old you are. The older you are, probably the longer it takes for you to have recovery. On the other hand, if you have a smooth transplant without side effects, you may be back at work within 3 to 6 months.
A transplant can be a stressful treatment, and the emotions that go with this stressful time can be difficult for patients and their families.
Many, many tears. Depression, highs, lows. But with the faith of God, you get through it. You know, a lot of lonely nights. But when you see it slowly climbing up instead of down, that gives you the stamina to hang in there.
I think anyone who says they're not afraid or concerned or is not being true to themselves. My emotions were like on a roller coaster. I mean, you know, one moment I'd feel like I was all right, and the next moment I'd feel like the world is falling in. You know, whenever you're, I think anyone is dealing with something that is totally unknown, you have a tendency to always go to the worst case scenario. And that's not bad, as long as you don't stay there.
Most patients, for some reason, think that life is a smooth curve, and when one day is not as good as the day before, they want to know why, what's wrong. But as we know, like in the stock market, there's good days and bad days, and there's a lot of ups and downs, and the doctors really are looking at trends, the trend over a week, the trend over a month, and that's really what matters. So sure, there's good days and bad days, everyone has them, true in transplant, like in life.
With Everett's personality being as outgoing as it is, it kept me from thinking the worst. He has a very, very positive outlook, and I'm sure that has a whole lot to do with how he has been able to handle this disease and survive it.
I would ask, why did this happen to me? It doesn't seem fair. And sometimes it really doesn't seem fair. But yet knowing that there's a purpose for it and having that support, that love, it's what keeps you going.
Patients and doctors alike agree that the role of the caregiver and the support of friends, family, and the community are critical to recovery.
Oh, the support system for the patient is very important. His family, his significant other, his friends, his community, his church, all are in order of importance there. Of course, the family is the first, is their faith. I think each one of those components are very important to encourage the patient to continue trying.
It is necessary for every patient to have a designated caregiver. Depending on the patient, a caregiver may help with medical, financial, and social needs. This person plays an important role in the patient's treatment and recovery. In many cases, it will be your spouse, but it could also be an adult child, other relative, or close friend. Some patients may have more than one caregiver. Your caregiver will have many responsibilities, which may include household chores, transporting you to your doctor's appointments, taking care of you during recovery, including making sure you take your medicine and monitoring for side effects, and taking care of the family finances. When considering transplant as a treatment option, it is important to have a caregiver or multiple caregivers who have the time and energy to be involved throughout the transplant process.
It's a 24/7 for the spouse and for the patient. It's constant, day in and day out. Good times and the bad times, but you've got to be there for them.
For a certain amount of time, that person needs a lot of support, minute by minute, hour by hour, and that's hard work. It's very, very hard work. And I think, each, especially a spouse, children need a lot of support as much as possible, and a lot of praise too, because it's hard work.
My advice would be to ask for help. Everybody is so willing to help out. My children would come over and relieve me while I maybe went out shopping for a couple hours. The caretaker has to take care of themselves because they have to remain strong to take care of the one that's gone through the transplant.
People want to support you, and they volunteer, but a lot of times we don't ever take them up on that offer. As support people and family, I think it's a really good idea. If they're going to offer to support you or help you out, definitely take them up on that offer.
Another thing that we found to be awesome was a care page. And I know we use care pages. There's a lot of other sites online that people can go to. You basically can go online and you can blog about the experience, and people can sign in and have email updates sent to them so they can sign in and know everything.
Now that you have more information about transplant as a treatment option, it's important to discuss all of your options with your doctor and your family. You can also use the booklet that came with this video to give you more detailed information about what a marrow and cord blood transplant involves, and specific physical, social, and financial considerations for patients 50 and older. And if you have fears about transplant or feel that it might not be right for you, it's okay to ask questions and talk about your concerns with your doctor.
I think a reluctant patient should listen to their inner voice. I mean, if their persona is such that they really don't feel comfortable with this, then they need to go with that. I think if that's the way they feel, they need to listen to themselves. They shouldn't be dragged into something that they don't really feel comfortable with.
Just remember, you are not alone. Ask your doctor questions. Talk to your family. Set your priorities and determine your best option for the possibility of a brighter future. If you have more questions about transplant as a treatment option, talk with your doctor. Your doctor is there to help you make the treatment decision that is right for you. You can also review the booklet that came with this DVD for more information about transplant as a treatment option. The National Marrow Donor Program's Office of Patient Advocacy also has patient services coordinators you can talk to with any kind of questions you have, anytime throughout the transplant process. You can call them toll-free at 1-888-999-6743 or email patientinfo@nmdp.org. All of these services are free of charge.